Got me? Mic check, mic check. Yep. Perfect.
Afternoon. Maryland has now gone over 10,000 confirmed cases with 10,032 cases of COVID-19. 2,231 patients have been hospitalized in Maryland to date, and sadly, 349 Marylanders have lost their lives to this deadly virus in the past month, including another 47 Maryland deaths yesterday, added to the 40 deaths on Monday, making it our deadliest 48 hours to date for the coronavirus here in Maryland. There are now over 18,700 cases in the Maryland, D.C., and Virginia area, and more than 600 people have died in the National Capital Region. On a more positive note, 607 Marylanders have recovered and have now been released from isolation. Last month, after we discovered and reported on our first case of community transmission in Maryland, we immediately moved from the initial containment phase to the mitigation phase, ramping up our hospital and medical capability and focusing our resources on hotspots and our most vulnerable populations. Early projections from Johns Hopkins indicated that without us taking drastic actions, this pandemic would infect nearly 360,000 people in our state and potentially kill more than 12,000 Marylanders by June 1st. We decided to take early and aggressive actions in order to stop that from happening and to avoid becoming the next New York or Italy. Our early and aggressive mitigation actions were in an effort to flatten the curve, to prevent the overwhelming of our hospital systems, and in order to save the lives of thousands of Marylanders. All of our Maryland citizens have been an important part of that effort to slow the spread of this deadly virus. And fortunately, we are now beginning to see initial signs that these actions are making a real difference. While our case numbers are still growing each day, and sadly, the number of deaths is continuing to increase, both are at much lower rates than they would have been without those actions. And on a positive note, over the past few days, our hospitalization rates are starting to show possible signs of stabilizing. In addition, we have dramatically ramped up our surge capacity, our testing capability, and our supplies of PPE. And our contact tracing teams are also having greater success because people are staying home and limiting their contact with others. Fortunately, because of the early and aggressive actions and because of the extraordinary sacrifices of Marylanders, we're now in a position to move from containment and mitigation to plan the gradual rollout of our recovery phase. Our numbers are still rising and we're still heading up that curve, so we're not quite there yet. But we are seeing positive signs of cautious optimism. Over the last several weeks, we've been consulting with experts and developing a roadmap for the reopening of our state and our economy in consultation with our coronavirus response team of doctors and public health experts. We will be discussing those recovery plans in much greater detail next week, but I can assure you that those plans will be well thought out, gradual, and safe. Because if the recovery is not done in a thoughtful and responsible way, it would not only cost lives, but it would deepen the economic crisis and actually prolong the problems and slow our recovery. There are some very real reasons for hope and optimism right now, and there is clearly a light at the end of this tunnel. But exactly how and when we will get to that light is going to be up to each and every one of us. Right now, while our numbers are still climbing, and while we're still heading up that curve instead of down, it is absolutely critical for Marylanders to stay at home, to continue avoiding crowds and gatherings, and to aggressively practice social distancing. A few moments ago, I signed an executive order which will require the wearing of masks or face coverings when inside any retail establishments, including grocery stores, pharmacies, and convenience stores, or when riding on any form of public transportation in Maryland. It also requires all essential retail locations to require their staff to wear face coverings and requires those businesses to put into place appropriate social distancing measures in order to keep their customers and their staff safe. To give these retailers time to make these adjustments, this order will go into effect beginning Saturday at 7 a.m. I want to commend a few of our hotspots for having already taken some of these actions in their local jurisdictions, including Anne Arundel, Prince George's, Montgomery, and Charles counties. The CDC has issued detailed guidance on how you can make homemade cloth face coverings, which is on our website at coronavirus.maryland.gov. In our immediate efforts, this is really another important step in our immediate efforts to protect public health and safety, but the wearing of masks is also something that we may have to become more accustomed to in order to safely reopen our state. Now, our recovery plan will have 4 critical building blocks. First, the need to exponentially expand our testing capability. We have already greatly expanded Maryland's testing capacity by more than 5,000% in the past month. And we're on track with an even more aggressive plan to more than triple our current capacity up to 10,000 tests per day. The state has recently secured an additional 40,000 tests, including 30,000 that will utilize the state's new Abbott M2000 testing machines. These state tests complement the other testing that is occurring in clinical facilities and private commercial labs across the state. Today, the state entered into a separate agreement with Abbott Labs to acquire a substantial number of antibody tests. This will be particularly valuable as we look toward the recovery phase. Second necessary building block to reopening is increasing our hospital surge capacity by 6,000 beds. It's an ambitious plan that we are delivering on weeks ahead of schedule. Last week, we completed work on the 250-bed field hospital at the Baltimore Convention Center. In partnership with the U.S. Army Corps of Engineers, we have begun converting the Hagerstown Correctional Facility and the former Washington Adventist Hospital in Tacoma Park, near where we have some of the highest concentration of cases in Montgomery County. We're completing construction on a surge response tent at Adventist Fort Washington Hospital, located in Prince George's County, in a part where we have the highest case rate. We're also currently setting up 60 additional response tents in Frederick, Jessup, Hagerstown, Annapolis, Baltimore, Germantown, and Randallstown. Third, ramping up our supply of PPE, which is being headed up by a multi-agency task force who've been working around the clock 7 days a week with large deliveries coming into our warehouses on a daily basis. Just in the past week, we have received 1 million additional face shields and 1,000 ICU beds. And in the next week, we are expecting deliveries of 4.5 million additional N95 masks, 290 oxygen concentrators, and 252 additional ICU ventilators. And fourth, building a robust contact tracing operation that will enable us to investigate every single positive case and to ensure that those patients are isolating during the duration of their illness. We currently have approximately 250 people conducting contact tracing across the state. We plan to quadruple this force to at least 1,000 dedicated contact tracers by utilizing additional state employees, outside contractors, and through other methods. Last week, we became the first state in the nation to launch statewide strike teams composed of members of the National Guard, local and state health departments, and doctors and nurses to bring triage, emergency care, supplies, and equipment. The Vice President used us as an example for the rest of the nation in a call with governors last week. These strike teams have already successfully responded to outbreaks and threatening situations in 16 nursing homes and assisted living facilities and 15 group homes for medically fragile children. And now, this week, in partnership with FEMA and HHS, we have augmented our Maryland strike teams with 3 disaster medical assistance teams, which are made up of physicians, nurses, paramedics, and safety officers. These elite teams bring many years of disaster relief experience, and they've been tasked with conducting medical assessments of patients in skilled nursing facilities, and they will assist staff with testing and infection control practices. We are continuing to work together with our neighbors in the region, and on almost daily basis. We have another meeting on Friday with Governor Northam and Mayor Bowser to discuss regional issues and our continued collaboration as we move forward. And now switching to my role, my national role as chairman of the nation's governors. I just hung up the phone right before walking down here with Vice President Pence. On Monday, I led another teleconference with my colleagues, Vice President Pence, members of the President's Coronavirus Task Force. Earlier this afternoon, I led another teleconference of the National Governors Association. It was our 14th such call over the past 30 days, where we discussed our coordinated response to COVID-19. Tomorrow, we have another call scheduled with the President, the Vice President, and the federal team. And the states appreciate the partnership with and the assistance from the federal government during this crisis. However, additional federal action and assistance is critically needed right now if the governors are going to continue leading on the front lines of this battle. Without sufficient federal investment, we will be unable to do all of the things that we're being asked to do, and states could be forced to confront the prospect of devastating budget reductions to essential services and potential layoffs, which could hinder our abilities to provide necessary services and which could also further prolong the economic recovery and severely limit our collective efforts to get people back to work. So I've been calling on our national leaders in Washington to put aside partisan politics and differences and to try to get this done for the American people. We've asked the Trump administration to support the governors and the states and ask for their help in breaking this logjam in the U.S. Senate so that we can continue working together to fight this pandemic and to get our states and our economies back on track. And lastly today, before I turn it over to some of our team members to make some presentations and before we get to your questions, I just want to take a brief moment to recognize one of our unsung heroes. We've been doing our very best to keep Marylanders informed, and an important part of that has been ensuring that all of our citizens are able to receive timely and equal access to information. And Jimmy Belden, our American Sign Language interpreter, has been a constant presence at our press conferences. And I think Jimmy has done a great job of helping us reach Maryland's deaf community throughout this crisis. And today is actually National ASL Day. So I thought it was the perfect day for us to present Jimmy with a governor's citation recognizing him for his dedicated and selfless service to the people of Maryland. So thank you, Jimmy. I don't know how you can sign while I'm doing this. You gotta take a picture, then we gotta get you back to work. Maybe I'll hold this for you. With that, I'm going to turn it over to our Deputy Secretary of Health, Fran Phillips, who will provide us an update on our COVID Connect registry and on our contact tracing operation. Then we'll hear from a couple of other members of our team. Thank you.
Well, thank you, Governor, and congratulations, Jimmy. It's a pleasure to be a colleague with you in this struggle. And Governor, thank you again for all of the massive the response across Maryland that you have led, and I just want to thank you. You've heard so many of our efforts. I want you to know that my colleagues across the country in state health departments have reached out to me and to ask for advice and for guidance on how we are doing some of the things that you have championed. So thank you for that, Governor. A couple things to highlight. As the governor said, we are at the point now of looking at this tradition in public health, which is contact tracing. Contact tracing is it's another word for disease investigation, and this has been the hallmark of what has happened in public health really for centuries. And so we have right now in our public health workforce across the state in local health departments, we have people who are trained and whose job it is to be disease investigators, whether in the past that has been tuberculosis or that could have been sexually transmitted disease or a foodborne outbreak. But now 100% of those disease investigators are engaged in contact tracing around COVID-19. So let me explain the points of contact tracing. Fundamentally, that begins with a test, and we'll hear some more about the progress that's been made on COVID testing. It begins with a positive test, and when that happens, contact tracing is triggered. The investigator reaches out to that person, that patient, and does an extensive interview on everything that that patient has done for the last 2 weeks, all of the places that person may have traveled, and all of the people with whom that person may have been in close contact. As the governor mentioned, because of the success really of Marylanders in doing social distancing, in staying home, in fact, the recent experience of contact tracers is that the circle of contacts has become smaller and smaller as people that we reach out to with a positive test say, I can tell you exactly where I've been home, and I can tell you exactly who I've been with, it's been my household members. So that's evidence to us, again, of certainly the cooperation of Marylanders. What happens with that contact tracing then from the first case is the investigation to find those contacts, to reach out and to do the investigatory work in order to reach people who may have been exposed, to put that contact, that known person, into isolation, to support that person and to monitor their symptoms, to find the contacts, and then again to reach out to those contacts, to have them be put in quarantine, and to have those people be tested. So it's a circle, as you can see. We have now, as the governor said, about 250 people. That's an estimate in public health right now. In order to massively increase that workforce, we will need to ramp up considerably in order that we can reach every single new COVID positive case in this state, and that is the goal, to suppress this virus. Second thing I want to say is to thank the Marylanders. And there are over 800 Marylanders now who have stepped forward and have voluntarily registered on our website, that's COVID Connect website, registered as having recovered now from this virus. And actually that's a few more people than we have confirmed cases. But nevertheless, these are people who have stepped forward to do a number of things. First of all, they volunteered to receive information. They volunteered to have information come to them as to how they can participate in research or clinical trials. They volunteered either to participate in or to lead support groups. And over 100 of those people have wanted to publicly share their story about their recovery, about their experiences while in isolation, and in order to make that helpful for others going forward. So we're in this for a very long time. We are in this contact tracing. We're in this for a very long time. We will prevail. We will get past this virus. But right now is not a moment to let up. This is absolutely not a moment to relax. This is a moment to stay at home and to do the things that we all know have been very, very difficult to do. But as the governor has said, we are starting to see progress. So thank you for that. I'll turn this over now to Secretary Churchill to talk about PPE. Secretary Churchill.
Thank you, Fran. First I'd like to also thank Governor Hogan for his tremendous leadership on this situation through these unprecedented times. Not only are we grateful at the department, but I know that that is the sentiment that I hear from suppliers and vendors who reach out to our department on a daily basis. In the wake of the COVID-19 pandemic and at the direction of Governor Hogan, the Department of General Services Office of State Procurement has developed a cross-functional sourcing team. Our team not only includes our procurement office, but procurement officers from the Department of Health, Transportation, and Housing and Community Development. General Services continues to prioritize the sourcing and order of personal protective equipment, ventilators, and other critical material based on the need from state agencies and local jurisdictions. And in addition, over the past months, we have worked with our partners to source, order, and deliver needed supplies, equipment, and services to the Baltimore Convention Center and to other temporary medical sites across the state. We are working 7 days a week to ensure that the necessary product services and acquired coordinated logistics for various operational support across the state as related to the COVID-19 response. The state, as the governor has indicated, is placing big orders. Orders of this size are not here instantaneously, but we are receiving weekly deliveries. And over the past week, we have received a number of different items, including face shields, surgical supplies, including masks and surgical gloves, hand sanitizer, bleach, and as it was referenced, equipment like beds, including ICU beds. And over the next 7 days, we're expecting deliveries of oxygen concentrators, ICU ventilators, including masks such as NIOSH-approved N95 masks for hospital use and KN95 masks typically used for occupational grade respirators. As the weeks progress, and in the months ahead, our warehouse will continue to receive large deliveries, millions of units of critical PPE equipment, again, such as the N95 and KN95 mask, surgical masks, gowns, face shields, goggles, hand sanitizer. And in addition to this critical PPE, it is worth noting that with the support of our partners and managing all the deliveries and equipment such as ICU vents, X-ray machines, radiological support, durable medical supplies, diagnostic equipment, furnishing, and all the related equipment that's required to maintain and operate a field hospital location. We can't do it without our vendors, and General Services is very appreciative of the overwhelming response from the suppliers who have stepped up and reached out to offer high-demand PPE and equipment which the state needs. And we continue to allocate additional resources to review the incoming orders and offers that are coming in. We encourage suppliers who may have items of need to reach out to resource.mema@maryland.gov. I'll repeat, resource.mema@maryland.gov. And finally, I'd like to take a brief moment to thank the entire team, those who are working in the shadows of their makeshift home offices, who are fielding calls and writing orders, including our procurement officers, sourcing specialists, expediters, and emergency response specialists, all who are working extended hours, 7 days a week. And they are providing a solid foundation to keep those who are on the front lines stocked with material. So with that, I thank you, Governor, and I will now turn it over to Roy McGrath, Chairman and CEO of the Maryland Environmental Service.
Good afternoon. I'd like to begin by thanking Governor Hogan, who's demonstrated remarkable leadership during an unprecedented challenge for our state. There's a number of great public servants who have stepped forward in order to serve in ways that are not typical of their usual responsibilities. Some of us who possess transferable skills have been asked to use those skills in a way that most effectively helps the state serve its citizens. Some very actively behind the scenes, and many working incredible 7-day-a-week hours, as Secretary Churchill mentioned. I'd like to add my thanks to those who are helping to fight this crisis. In my case, weeks ago, Governor Hogan asked that I serve the state by putting my experience as a former member of his executive staff and my nearly 20 years of pharmacy and healthcare advocacy experience to work on the state's coronavirus response. My team at the Maryland Environmental Service, about 600 of whom are essential workers, continue reporting to work every day, doing an incredible job for the state, the counties, and the 228 cities and towns across Maryland that we serve, providing essential services such as water and wastewater management, recycling, solid waste services, and ensuring that these continue uninterrupted. I want to thank my incredible teammates at MES for their amazing work. There are a great number of them who are teleworking at home for the first time, and they're doing a yeoman's job of enabling all of the rest of us to do our work too. Over the past weeks, Maryland's success has been in aligning key departments and agencies involved in the coronavirus response. As you heard earlier, the Departments of Health, Emergency Management, General Services, and Commerce, among others, are all working closely together in order to accomplish our task. As Governor Hogan said, one of the principal challenges faced by states across the nation has been ramping up our testing capacity here in Maryland. Access to testing equipment and supplies remains in profound demand across the nation and the globe. Maryland is making good progress, and I'd like to reemphasize some of the examples that Governor Hogan shared with you today. The state recently secured the necessary materials to perform more than 40,000 tests from a combination of suppliers, including Abbott Labs, Cepheid, and MGI. 30,000 of these tests will utilize the state's existing M2000 testing machine, which means faster deployment and increased testing in Maryland now. These state tests complement other testing that, as the governor mentioned, is occurring in private and commercial labs across our state. A limited number of these are rapid tests, and the state continues to work with Abbott, Cepheid, and other suppliers in order to acquire more quick tests. In closing, I also want to acknowledge the hundreds of companies, Secretary Churchill touched on this, many of whom are here in our state, who've offered their services and their supplies to the Maryland Emergency Management Agency and to the Department of General Services. Together with the other state agencies involved, we are focused on efficiently reviewing and responding to all of these offers. So we want to thank them sincerely for their commitment to Maryland and our focused response to the coronavirus. With that, I'd like to turn it back to Governor Hogan.
Well, thank you. All these team members have just been doing an incredible job. All although when they say they're working 7 days a week, that's really no joke. I mean, they're actually working, in some cases, 24 hours a day because they're sourcing things all over the world, and some other countries in Asia that are 12 or 13-hour time differences, and they barely get any sleep. I did make Secretary Churchill take off Easter Sunday so his little girls could have an Easter egg hunt, because I said the Easter Bunny was essential service, so yeah, glad he got a chance to do that. But other than that, I don't think they're getting much sleep. I really appreciate all the great work everybody's been doing in every department.
Governor, you outlined the first steps that would need to be taken in order to start moving back toward a regular, what we would think of as a regular life. I think a lot of people out there want to know how soon that will happen, when we'll start seeing tangible results of being able to get back to some semblance of normal life and being able to send their kids back to school and open their small businesses back.
Yeah, I think everybody would like to know when we're going to get back to a normal life, and that's the kinds of things we've been thinking about and talking about and planning for many weeks now with a lot of really smart people. As I mentioned earlier, we don't know the exact answers to those questions yet. We're starting to slow that growth slightly. We have not yet reached the peak, so now would be the worst possible time to consider kind of taking our foot off the accelerator there. But when we start to see the right metrics, and we have a plan that we're going to be putting together, and I mentioned next week we'll be announcing some of the further details about that. But before you could even start that, we have to do these 4 things I mentioned today. But sometime in the next week, we'll be laying out not the exact details of a final plan, but at least kind of we'll hopefully have some progress and some metrics and some further discussion about to help give people some certainty about when things might start to get, we might start to take actions.
What would you envision the new reality being? We're wearing masks now, and you see restaurants and every other place. Is it too soon? Or what do you think the new reality would be?
So nobody knows exactly what it's going to be. And look, the president is going to have an announcement tomorrow. He's going to have a call with the governors. He's talking about, they have a national federal team that's working on some suggestions and guidelines. Each of the states are looking at these things independently or in groups. The National Governors Association is talking about this. Our internal experts have differences of opinions about what the new normal is going to look like. I think we're going to lay out a plan in the next week or so that says what that's going to be, but it will include, everybody wants to get back to normal. I want to get back to normal. Everybody here does. We want to make people feel like they're going to get some of their lives back as quickly as we can. We want to get our economy back. We want people to get back to work, but we want to do so in a safe and smart way, because the worst possible thing we could do is to take actions too quickly and then have that spike so we look like New York and we have thousands of people die and hundreds of thousands of people sick and we overload our hospital system, because then it's very hard to get that genie back in the bottle.
How much testing do you need to see? Do we need to have everybody available to test?
Our goal, which is a very aggressive goal, is getting up to 10,000 tests per day, which for the size of our state is probably the most aggressive goal that I think anybody's put out there, but we believe that we're going to be on track to try to get there.
In terms of, you can't get back to normal until you complete a massive contact tracing plan, which we all know. Johns Hopkins released some numbers this week saying you might need tens of thousands or 100,000 people to do this. Can you hire that many? Well, with 250 plus 1,000 people for the trip, and you have the tests and all the equipment to be able to carry all that.
I mean, we have the leading public health expert from Johns Hopkins on our coronavirus task force, which is Tom Inglesby, and we're talking more like 1,000, which is the number we're hiring. I don't know who came up with that. Somebody at Johns Hopkins might have come up with a higher number, but I know it's what Massachusetts, which is about the same size as us, Charlie Baker, who's a good friend and colleague in the National Governors Association, is talking about the same goal, about 1,000. But we're going to do whatever it takes to make sure we can try to get people on track. But no, it wouldn't be probably possible to hire 100,000 people to.
Does that mean that people will change the guidelines in terms of, will people who just come in contact with someone who was positive, will they get tested, or will they just be told to quarantine?
I think as the testing becomes more readily available and as the different types of tests become available, some will be rapid tests, some will be antibody tests, some will be the ones that take a longer period of time, and I think maybe Fran could address that in more detail, but we'll be able to test more people, and there'll be different utilizations for the different types of tests, but it will be much more widely available. Right now, because there's such a limited and constrained amount of tests, and there were requirements about we only have this many tests, and we have to test the people that are really sick. You can't just have everybody go check. I think we'll be able to get to the point where we'll be able to test people who have come in contact and people that we believe are in vulnerable populations and people that are in places where we think that it's going to help us.
There have been some tensions, of course, with the president talking about who's in charge or opening up what when, and of course there being some obvious resistance about that from governors. Given you haven't had some talks with them, how would you characterize how that is playing out now? Are governors kind of pushing back against that now? And is the president kind of pulling back? How is that? That just sounds like an interesting dynamic.
Well, it was an interesting dynamic. It's played out over the past 24 hours or so. There was obviously quite a bit of coverage on this over the past 24 hours when the president first said, he was in charge and he was going to tell the governors what to do. I believe his messaging completely reversed. He did a 180 by the end of the day in his press conference where he said governors will make their own decisions based on their own time frames in their own states, based on the facts that they determine. Look, I think we're going to have a productive discussion, hopefully, with the president and his task force tomorrow with all the governors. I had a very fruitful, productive discussion with all the governors earlier today and a separate one following that with the vice president. I believe that we can be partners in this. There are some smart people on the president's task force. I think they can give us some good guidelines, and the federal government can be a good partner with the states, and we can follow some recommended guidelines, and then the governors make, to share information and facts and ideas that help the states, I think is really good. And there are certain roles that only the federal government can play and should play. But I think the governors are going to make their own decisions within those recommended guidelines. I'm sorry, Tom?
Because you took early action, your residents are a month into this. And today we have this new executive order regarding food passes. It's a very critical time that where you are with this, your residents have had 4 weeks under the belt. And there have been some counties that did this already. Are you concerned at all, and can you speak to those residents about not taking their foot off the gas right now? Because we do see people kind of going out and maybe in some places being that plastic.
I think while we see some hopeful signs, that was the message I'm trying to convey today, is that because of all the sacrifices that everybody in the state has made, and because we've done a really good job of people staying home, and I know how hard it's been, and people are itching to get back, right now is the really worst possible time. We're like 2 weeks behind New York and Louisiana. We don't want to see those numbers. We're not one of those states that's kind of over the hump and coming down. We're still going up in the whole Washington metropolitan area. Pretty concerning numbers. I just talked about 18,600 people dead in the region. It's better than we had hoped, and we think we're making a difference, but the worst possible thing that could happen would be for people to say, it's not that bad, let's go back to normal, and then it will be really bad. So we're just asking for caution. Pam? Yeah. We've actually been talking about it for weeks, like 3 or 4 weeks, because we always knew